Leading local care.
Improving lives in Manchester.
With you.
In April 2018, we launched a new public sector organisation in Manchester which will transform community-based health and care. For the first time, the organisations that provide community health, primary care, mental health and social care services in Manchester are working together in partnership to join up community-based health and care. This means that we're bringing teams together from different organisations to work with each other collaboratively. We're changing the way that community-based health and social care in Manchester is designed and delivered. We're integrating our services and building new and better ways to deliver care. We're bringing services closer to people's homes, creating local teams in each neighbourhood. We're working together with local people and communities, and with local groups, charities and organisations to help to design the right services for each neighbourhood. We're supporting people to keep well, to be independent and to be connected to local support and communities. We're putting people at the heart of everything we do.
So the Manchester Local Care Organisation is a partnership between organisations which you will recognise. In Manchester, the GP surgeries, the Mental Health Trust, the Council and the hospitals have all come together in a partnership for the good of patients.
Making it easier.
Providing the support and systems for us all to work together collaboratively across different organisations.
Reducing duplication and silo working.
Making more of the buildings we use.
Sharing data and improving IT.
So instead of having different bits of information in different parts of the system, we'll be able to collect it all together and plan and organise new services in a different way, so that we don't have to think about what happens in a GP surgery separately to what happens in a hospital, and separately to what a social worker might do, and separately to what a mental health worker might do. But instead we can get all of those people together in one room and come up with one plan for what's best for the people and patients in Manchester.
To achieve what we want to, and to create an organisation that is able to put people at the heart of their care, 4 big organisations that already work in Manchester have given us some responsibility to do that, and those organisations are the local authority, so Manchester City Council, Manchester Foundation Trust, which is the big hospital trust in the city, the GP federations, which represent all of the GPs and practices across Manchester, and the Mental Health Trust. And they have all agreed that they will give us some power to change what is on offer to people across the city in collaboration with the voluntary, charity and other sectors to create something quite different that has the power to change some of the way in which we've done things for a long time.
It's a real strong partnership between health, social care, primary care, mental health in its purest form. But beyond that, it's much more than that. It's about voluntary sector, it's about working in communities, working in people's homes, being really close to the neighbourhood, but with the philosophy that it is a very much integrated, multi-professional way of working.
Manchester's got thousands of dedicated health and care workers, and we're building on a strong platform of people who are committed to the people of Manchester and making a difference in their lives. We've got very strong plans to make a difference. We've seen the biggest ambition for hospitals in the single hospital system. We've seen health and social care commissioning come together, and we're really the third element of that plan, developing all of the community and neighbourhood services to be integrated, both to deliver better care but also better population health prevention and to improve the health outcomes in Manchester.
This is about developing our relationships, understanding each other's roles and transforming our care models with people at the heart of everything we do to make sure we're supporting them to lead better lives, have more independence, and really importantly that we're involving them in all of our plans going forward and asking them what is important to them.
Simplifying the journey through our health and social care services.
Working with local people and supporting carers.
Involving people in their care.
As someone that uses services in Manchester,
it can be very difficult at times. Things like going to different hospitals if you have multiple health conditions, you end up carrying a filing cabinet literally of your notes. I want to have a say, you know, what works for me, what doesn't, you know. I want a two-way conversation. I want to see sort of better integration.
Person-centred care is essentially care that starts with what's important to the person. So rather than starting with diseases and problems and trying to fix things, we start off with what's important to you, what are your goals, what are you trying to achieve, what would being healthy or having a better quality of life look like to you.
Locally designed care delivered in neighbourhoods.
Reducing inequalities in experience, access and care in different parts of the city.
Moving services closer to people's homes.
So we know that a lot of the services that we provide, people would prefer to have them closer to where they live and accessed in a way that suits their lives better. So it doesn't mean that everything necessarily has to be in a hospital and that you have to travel to a big, a big building and park and work out complex systems just to see a doctor or a nurse or another healthcare professional. It might be that we can bring those people either to your home or to your local GP surgery or to a local community venue.
I'm really excited because no one agency can do this on their own, and really importantly we have a duty to collaborate, we have a duty to work together and really further develop those relationships with people at the heart of everything that we're doing. And if we do that, we stand a really good chance to deliver better outcomes for the people of Manchester, better experiences, and really importantly we'll get rid of some of the duplication and we'll make much better use of the resources across the whole system.
So I think for the first time in my experience working in healthcare, both in hospitals and community services, this is the first time we've had the opportunity to work in a much more integrated way, connect teams in a much more integrated way, and make sure that conversations and support for families, for carers and for people and patients are all much more joined up in the system. And it's for us to use that knowledge and information to set out and improve services over the next 2 to 3 years. Over the next 10 years, that plan has to take account of the requirement to improve public health outcomes in Manchester, to improve daily living, to improve access to good advice on health, nutrition, support, exercise, and the things that we all know ultimately enable better public health outcomes for the people of Manchester. We are going to lead and challenge some of the ways in which services are delivered to improve them for the population of Manchester working together. And we have plans to do those ideally at very much a neighbourhood level. We have 12 identified neighbourhoods in Manchester. We've developed neighbourhoods that will encompass around 9 or 10 GP practices across the city. Those neighbourhoods will come together and they will support the patients, the individuals with the greatest levels of need, and will improve the way in which they get access to care. So mostly individual people, patients, will access services in the way in which they do now. Sitting behind that, though, is a much more joined-up approach to how we plan for your care and how we deliver that care across the city. The LCO in Manchester is seeking to support hospitals by speeding up the processes around which patients leave hospital. We can look at patients' requirements who might not need hospital and can access directly care in the community. So we'll hope to have those interventions in place.
We very much rely on the teams that already exist, so one of the things we don't want to do with this new way of working is duplicate anything that's already there. We recognise we've got some very good teams and very good services that work very well at the minute. It's more around how that communication is shared, so we very much link up with those teams within the hospital.
A patient will tell me about the difficulty they've had getting a hospital appointment or a letter from the Mental Health Trust or accessing some piece of social care that they need for themselves, or it might be for their elderly relatives or for somebody else in the family. And joining all these different bits of the jigsaw takes a lot of time for GPs. Those areas where communication falls down or people don't work together with one collective aim, they'll be improved by the local care organisation.
In my experience as working as a physiotherapist in both community and the hospital, you see a lot of breakdown in communication from different services, and it always affects the person, and they always end up with the one coming out worse from it. So improving communication and improving that continuity of care from hospital to home is absolutely vital, and to see it happening makes me really proud.
Helping people stay independent in their homes and be connected to local support, services and community groups.
Shifting the focus of care away from hospitals and into our communities.
I think we're on a journey in Manchester about understanding and changing the way in which we think about public services. We know that for people's own health and well-being, staying at home, being close to family and friends when they need care or support is the best thing for them, and that really people should only be going into hospital or residential care or nursing care if that is the only option. So what we're trying to build at neighbourhood level are a range of different options that people can choose from, and we want to support that by giving people some personalised budgets, so some money and resources that they can use to buy that for themselves and to have the power to change their own lives, as opposed to a service model that just looks at the difficulties that people are having.
Coming to a door near you soon will be a neighbourhood partnership that you could get involved in, either by being involved in an annual planning event for your neighbourhood or working with people who do provide services in that area, by having a new kind of conversation about what's important to you, about what would make a real difference in your life, about what's working well in your community that you think there should be some more of, or where you think there's something that you really need that isn't there, and how you might be able to work with other people to make it happen.
There's absolutely a clear model developing with our colleagues in the voluntary community services sector around how we connect people who live in neighbourhoods to help and support. At the moment it can be really difficult even for professionals in the health and social care system to navigate for relatives, for example. We aim to make that much simpler in the City of Manchester through access to public buildings, information, websites, and a better description of how we've joined up our services across the whole.
The things that influence people's health and keeps them healthy, a big part of that is about having really good health and care services and medicines and doctors and nurses, and they're really important. But what has even more of an influence are eating healthily, having family, friends and being connected in your community, having green spaces that you can enjoy being active in and going for walks and running, having a safe, warm house that's secure. Those are the kind of things that really keep us healthy and well. But for health and social care organisations to have an influence on those things, we need to work with housing associations and the people that run the transport and the voluntary and community groups in our neighbourhoods that run all sorts of different activities and things that can help people make friends and just keep well in their communities. Where the LCO can really make a difference is facilitating those connections and those relationships, and especially within those neighbourhoods, really providing the spaces for people to get together and build relationships and have conversations. And once we start bringing people together in the neighbourhoods with a focus on what's going to keep us healthy in this place, if you like, I'm sure all sorts of creative solutions are going to emerge that we wouldn't have thought about if the LCO hadn't been there.
We believe that by working together, we can help the people of Manchester to
have equal access to health and social care services,
receive safe, effective and compassionate care closer to their homes,
live healthy, independent, fulfilling lives,
be part of dynamic, thriving and supportive communities,
have the same opportunities and life chances no matter where they're born or live.
What I believe is that through enabling lots of people to talk about what they need, through capturing a real diversity of voice and of people's preferences and experiences, I think we can build something that is really incredible.
Leading local care, improving lives in Manchester with you.